Welcome to Performance Improvement, created for the healthcare team. This learning initiative provides you with self-directed, web-based resources to help you explore your office's clinical practice procedures as you assess, document, and treat patients in your practice. Our learning initiatives will guide you as you measure your clinical performance and knowledge, assess your current practice, apply your knowledge through performance improvement, and learn through your self-evaluation. We will guide you every step of the way. The Interstate Postgraduate Medical Association designates this PI-CME activity for a maximum of 20 AMA PRA Category 1 credits. Physicians should claim only the credit commensurate with the extent of their participation in the activity. AAFP, Improving in Practice, and Maintenance of Certification Part 4 may be available with some learning modules. Your performance improvement module has 3 stages. You will start with a current practice assessment, then apply performance improvement into your clinical practice, and conclude by learning through evaluation. We will be there to help along the way. Stage A is the practice performance assessment phase. You'll begin auditing a selected number of charts, generally 10 to 30, into the chart documentation section of the performance improvement module. We'll compile this data and report aggregate information, which will allow you to assess your performance based upon current care given to patients in your practice. You will begin to identify opportunities to implement changes within your practice by reviewing your report card. After entering your chart data, you will complete the self-assessment phase by rating your actual and desired levels at relevant clinical competencies. You will then reflect on your practice through clinical vignettes. Clinical pearls reflecting best practices will encourage you to reflect on your current office practices. During Stage B, you will have the opportunity to implement your plan by applying what you have learned to your own practice. We'll provide learning resources to guide you as you make your own small tests of change. By recording your progress and any barriers you encounter, you will be able to reflect on the changes that you have made, new ideas that have changed your plans, and obstacles that prevent your progress. With your report card in hand, you'll compare desired and actual abilities to help you develop your own practice improvement goals. We'll provide you with tools to record your goals, anticipated barriers, and your progress. Learning opportunities will be provided to further enhance and help you meet your goals. You can also add your own educational resources. During this phase, you'll document successes and obstacles in meeting your goals. This phase will last anywhere from 1 to 12 months. During Stage C, you will be able to evaluate your learning. During this final phase, you will repeat the chart documentation to see if your changes had any impact on your clinical performance. You will complete a practice assessment questionnaire and reflect upon your experience. You'll assess how you implemented changes into practice and the impact these changes have made on patient care. Your credit certificate will be delivered upon completion of all 3 phases. This performance improvement activity is not a solitary experience. The tools you are developing can be applied to other clinical and process opportunities in your office. PI is part of your lifelong learning. Performance improvement. Get started today. Contact IPMA at 608-231-9045 or www.ipmamed.org for additional information.